Broadcast is now starting. All attendees are in listen-only mode.
Good morning, everybody. I almost said good afternoon, since we usually do these in the afternoon. Welcome. My name is Fields Mosley. I am the Communications Director for Maricopa County, also the lead Public Information Officer at the Joint Information Center as we respond to the pandemic, the COVID-19 pandemic. So I'd like to thank all the reporters joining us on the webinar. We appreciate you being here, getting some information. We'll do our best to answer your questions today. Thank you to members of the public for joining us on YouTube or Facebook. We always welcome you here, and we hope you find some of the information helpful as we go through the question and answer period today. So tomorrow's a big day. And we're all going to be talking about pods for a while now. That's points of distribution of the vaccine to deal with phase 1A of those that are receiving it. So Executive Director of Maricopa County Department of Public Health, Marcy Flanagan, is with us today. She'll make a short presentation about pods, also the arrival of the vaccine on Monday, and future vaccines that are in the process of being recommended by the FDA and approved by the FDA and that sort of thing. And there's a process for that. Also with us today, if you have questions about unified command and processes going on with logistics, PPE, that sort of thing, I have Director of Emergency Management, Robert Rowley, with us as well, and he can answer your questions. So a few housekeeping items, as always. Members of the media, you'll be called upon to answer your questions if you have virtually raised your hand in the GoToWebinar, and you need to make sure your microphone on your phone or your laptop is unmuted when we go to you, so you can answer your question. If you're struggling with that a little bit, you might have to log out of GoToWebinar, log back in. Sometimes you're clicking on the raise your hand thing and it's not working. We cannot control that. That's part of the software. So please log out, log back in. We'll get to you as quickly as we can, and we almost always have time for follow-up questions. So we'll accommodate those as well. So with that, I'd like to welcome Director Marcy Flanagan up here to the podium to say a few words, and then we'll start the question and answer portion.
Good morning. Thank you, Fields. We are excited to be on the verge of administering COVID-19 vaccines in Maricopa County. This Thursday, we will open 2 of our point of dispensing or pod sites. At these locations, eligible healthcare workers will begin receiving COVID-19 vaccines. These are by appointment only, and for those who have the most exposure and risk. Everyone from healthcare providers who see COVID-19 patients to the environmental services staff who keep facilities and bedding clean to EMS who never know what their next call will bring. We began the pre-screening process on Friday to begin verifying eligibility to those who are most at risk and could sign up for appointments first. Next week, we will have 3 more pod site locations open to serve the county and even more healthcare workers. This helps keep our healthcare workers safe and take care of those who are most severely ill. It also helps hospitals stay staffed so that when they can put people in the hospital beds who need them. This is the first wave of vaccines. As we provide vaccines to those who are most at risk and more vaccines become available, we will be able to offer vaccines to more people in our community. You may not know it, but this is what public health plans and prepares for. The fact that we are able to launch 5 locations to provide vaccine with complicated logistics to a specific set of people who are most at risk, this is the result of years of work planning for pandemics, fostering partnerships with organizations who can help support these critical efforts, and practicing it with mock drills. We hope the days to implement these plans never come, but here we are. And we made sure we are ready, and we are. We are grateful to those partners who are making this possible: Abrazo Health, Banner Healthcare, Dignity Health, Mayo, Honor Health, and Valleywise Healthcare, law enforcement and EMS, local emergency managers, the National Guard, volunteers, our public health staff, and so many more. While this is a point of light at the end of a tunnel, we still have a ways to go until we are out of this. With so many new cases being reported daily, we all still need to mask up, practice social distancing, and make decisions that feel tough but are nothing compared to the challenges of having COVID-19. Maybe you don't know someone directly who has had COVID-19, but more and more people in our community are getting infected and end up spreading it to those around them. It's up to you to stop that chain. So while we wait for a vaccine to be available for everyone, please continue to do your part to help stop the spread. We're getting closer to the end, but we aren't there yet. Thank you.
Thank you so much, Marcy. I guess I said points of distribution, it's points of dispensing. So I'll correct myself on that one. Also on Facebook, hopefully you guys can hear us okay with the microphone that's a little bit farther away from us. We apologize. We're just not getting a connection with that, but hopefully the audio is good, and we will project toward that particular microphone. With that, Ron, do we have anybody with a question for us this morning?
Yes, Fields, we do. Katie Davis-Young is on the line. Katie, your mic is unmuted.
Hi there. I'm wondering how many people you're estimating you can vaccinate in a day at the first pod sites?
Okay, so how many people we can estimate or the estimate on how many people we can vaccinate in a day. Of course, we have 2 pods opening tomorrow, and there will be more pods opening next week. So there are a lot of factors that go into that, Katie, but Director Flanagan will take that question.
Thank you for that question. So each of our pod dispensing sites have a different capacity, and that depends on how big the operation is and how many folks we have registered to go through. This initial wave, we're focusing on 123,000 individuals to go through and receive a vaccine, but the throughput at each site varies from a few hundred a day to upwards of over 1,000 a day. So it just depends on the location and how large it is and how many individuals are scheduled to go to that location.
Katie, thank you so much for the question. Ron, do we have another question?
Yes, Fields. Rachel Leingang is on the line. Rachel, your line is open.
Hi, I'm wondering, we're getting a lot of questions of folks who are in the later stages, who are over 65 or have underlying conditions. And I'm wondering if the county has any more details on, how they may be notified, how they would prove that they're in one of these groups, or if by that stage it might be that they could go get it at their local pharmacy or with their provider, just any sort of additional information you can get for folks who are in these, early phases, but after the healthcare workers.
Sure, we totally understand, Rachel. We've been getting a lot of those questions too, because we know there's a lot of excitement about vaccines becoming available. But as you all know, there's some distribution issues too, and supply chain issues that are way out of our control. But Director Flanagan can expand a little bit more on that.
So certainly as we move through this phase 1A and into phase 1B, we know more individuals in our community will become eligible for the vaccine. Part of the planning is determining how much vaccine we have available and when that will become available. When groups have been identified that their phase is ready to be vaccinated, you'll start seeing what that registration process will look like. Right now, the state is in the process of gathering information from large employers, from essential workers, to understand what that exact population is in Arizona, and putting the screening tool in place and publicly available for folks to start going through that. Again, a lot of this is based on timing of the distribution of the vaccine and how much will be coming to Arizona Arizona will determine, once we get into phase 1B, how do we prioritize? We know all the populations that fit in that, but just as we did with phase 1A, prioritizing the individuals within that phase 1A, because all 123,000 doses didn't arrive at one time, we know the same is going to be true for phase 1B. We estimate there's over 1 million people in Maricopa County that fit into that phase 1B. We know we won't be receiving 1 million doses. And so how we prioritize that will be based on when we know how much vaccine is available, and then exactly drilling down what that number means in each of those categories. And then you'll start seeing more information about registration.
All right, thank you very much for the question. Ron, do we have somebody else?
Yes, Fields. Michael Dudna. Michael, your line is unmuted.
Go ahead, Michael.
Hey there. Sorry, I still had to press the button.
Okay.
I have a couple follow-ups to the questions that were already asked, but my overall question is, how scalable is this, especially once we get to phase 1B when we're talking about 1 million people or and beyond? But the two quick follow-ups I also have is that 123,000 number you mentioned, is that just for phase 1A? And do we know how many people have signed up to get the vaccine so far this week from these point of distribution sites?
So I believe the 123,000 estimate is in phase 1A. Director Flanagan can certainly expand on that a little bit more and talk about how this might progress and grow as we try to get to those larger numbers and other partners that are going to have to be in place.
So as I mentioned on Friday, we launched our pre-screening tool for that phase 1A. Every minute, there's more and more of those individuals in phase 1A that are going through that process, actually logging on and going through the process of getting an email in return of how to register and sign up to make an appointment. The last number I saw, we were around 13,000 individuals that had gone through that pre-screening process. Again, this is for only the first 2 pods that are opening tomorrow, have individuals started to be scheduled. Once the other pods, we have confirmation that the vaccine is arriving, all of those kind of time slots will start opening up as well. When we move into phase 1B, you certainly won't see just 5 pods operating in Maricopa County. That'll be more of a hybrid distribution plan. So it'll be a combination of these pods. You may still see a few of them up and operating, but we'll also start to work with pharmacies to distribute the vaccine and large employers. So employers that are part of that critical infrastructure and workforce that have several thousand employees that have the mechanism in place to do a point of dispensing or a pod at their location. We have several contracts that we've had in place already with some of these large employers, such as APS, that when it becomes their turn and their phase is up and we have vaccine available, we could give the vaccine directly to large employers to administer as well. So when we get to phase 1A, when we're talking about 1 million folks in Maricopa County, you're going to see a variety of other, in addition to the pods, some other mechanisms to receive the vaccine. But vaccine being readily available at your primary care physician, at an urgent care center, those sorts of things, that's probably not likely to happen until next spring or maybe even summer, where the general population just go to their primary care physician to receive a vaccine.
Michael, thank you for the question. Ron, do we have somebody else with a question?
Yes, Fields. Cameron Pullum is up. Cameron, your mic is unmuted.
Yeah, thank you very much. A couple questions. One, when Moderna inevitably gets approved, and the state expects shipments of the Moderna vaccine to come in as early as next week, how will that be intertwined with our distribution sites when they're distributing Pfizer now? Obviously, you want to make sure that each person gets the Pfizer vaccine the first time and the second time, the Moderna vaccine the first time and the second time. How will that be divided up at these sites? And will it be even used at the pod sites at first? And two, a lot of people are asking me about proof of vaccination. Can you guys talk anything about that?
So you're asking whether or not we're tracking who is getting that first and that second shot. Also wondering about, however many thousands of doses we're getting of the Moderna vaccine, assuming that it's approved. I believe that's scheduled for tomorrow to be considered at the national level. How those would kind of be integrated into those into all 5 pods, at least for this Phase 1A program. So, Director Flanagan will take that question.
So that's a great question. You make a very important point that if you receive the Pfizer vaccine, your second dose will need to also be Pfizer. If you receive the Moderna vaccine, your second dose will need to be Moderna vaccine. So at our pod locations, our plan is to only use Pfizer in this Phase 1A. When the Moderna does arrive in Arizona, that will be used at all of the long-term care, skilled nursing, assisted living, all of those who are already also identified in Phase 1A for those residents and staff. That's where we'll use Moderna. It makes sense to do that because Moderna doesn't require the same temperature controls and those sorts of things, so it's easier to use in those outward locations as opposed to the pod location. So our pods will only have Pfizer for this Phase 1A. And the second question was, I forget, what was it about? Can you repeat your question, the second part? I know there were 2 parts, I'm sorry.
Yeah, I get a lot of questions about proof of vaccination. Is there anything you can tell me a little bit about what they'll get? I know there's been talk about these cards that will also remind you of your next appointment. If you could talk a little bit about that.
Yeah, thank you for the reminder. So everyone has, when you receive a vaccine, there is a statewide vaccination system that it gets entered into. So there's always that proof of receiving a vaccine. We've also heard a lot about these cards that will be available. Those will be available at the pod sites, and as you receive COVID-19 vaccine, you will be given one of those cards. But again, an official record of your vaccine is always available if you call the Vital Registry office, if you go to your primary care physician. They can always print out a record of all your official vaccines that you've ever received.
I almost wrote down that second one. Cameron, thanks for the questions. Ron, do we have somebody else waiting?
Yes, Fields. Juan Juarez is on the line. Juan, your mic is unmuted.
Hi, thank you. I was just wondering, because we saw yesterday the Phoenix VA hospital was given the vaccine. So is this considered tomorrow the official vaccination startup from Maricopa County Health, at least in the local sense? And also I was wondering, you guys don't have a Spanish translation today, or just haven't seen Joanna yet?
I'm sorry, Juan, I didn't catch that last part of what you asked. I'm sorry. Yes, you asked about Joanna Molina being here. Joanna, it wasn't available today, and we apologize for that. So yes, we don't have the Spanish translation today. So if we can help you with something else afterward, perhaps we can get a hold of somebody and help you with that. But yeah, today for the press conference, we didn't have her available. I'm sorry for that. So yes, your question is, was that officially the VA vaccination that we saw on the news last night? Was that the official first? You know, it is a local vaccination, but it's part of a different distribution stream, I believe. So Director Flanagan can take that question.
Yeah, so a lot of us saw the coverage of the first vaccine in Arizona being administered by a VA yesterday. And the VA, because it is a federal agency, actually receives its shipment on a federal allocation. It's not part of the Arizona local allocation. In Maricopa County, we are officially launching our first vaccines tomorrow at those pod sites. And so that will be our kind of kickoff and official start of us administering to that Phase 1A in Maricopa County will be tomorrow morning.
And by the way, the World War II veteran that was vaccinated at the VA was great, wasn't he? So well, thank him for his service, for sure. Ron, do we have anybody else with a question?
Fields, there are no more questions.
Okay. Well, if we don't have any more follow-up questions, wait.
I lied now. Now they jump in. Sorry about that.
I knew you were speaking too soon.
You got it. Linda Williams is up next. Linda, your mic is unmuted. Linda, you'll need to unmute the mic on your end.
Good morning. Thanks, you guys. Logistically, I'm wondering what is the most challenging aspect of this operation? From the outside looking in, it looks like a million moving parts. I'm looking for someone to give their opinion on at what point did you think, wow, this is impressive what we're doing, and this is the most challenging aspect. I'm just wondering for someone's opinion.
Well, I think we could probably offer you a logistics side of this, and there's also, in the operations and then partnering with so many people, a lot of, you're right, Linda, there were a lot of moving parts. I have the benefit in my position of just watching it all unfold, and it's pretty fantastic to watch so many people working together. And the Unified Command is it's been a challenge, but I'd like Rob Rowley to come up and talk a little bit about this. He and Director Flanagan, they share the role of being the head of the Unified Command with their two agencies working together and handling logistics and planning. That's a combination of their two staff, so there's a lot going on there. And Mr. Rowley, if you'd come up and address this.
Hi, good morning. Yes, this is a huge logistical lift for the county, and it has been from the very beginning of this operation. From when we started collecting PPE, trying to source it, distribute it to all of the different organizations and jurisdictions that we have from the very beginning. The county literally had to start from the ground up in building a very large and sophisticated logistics receiving and distribution process, something that we've been monitoring all along. Up to this point, we were just shy of about 5 million pieces of PPE that we've had to distribute across the county to long-term care facilities, hospitals, local jurisdictions, et cetera. And now we find ourselves kind of at the peak, the climax of the entire operation, where we're opening 5 different point of dispensing operations throughout the county. As Director Flanagan has pointed out, they vary in size. Some are very large operations, some are not quite as large, but we have located them evenly dispersed across the county so that we can distribute the vaccine as efficiently and quickly as possible. This has required the assistance of multiple different jurisdictions and agencies and healthcare providers to create these pods and have them open and ready to go at this point. What have been some of the complications of this? Well, a lot of it has been the information flow as it comes in. Things are changing quickly, sometimes hourly, as we find out when vaccines are going to arrive, which sites are ready to go, and when we can open them. As you know, we are opening 2 sites tomorrow and the remaining 3 on Monday. And this information changes on a day-to-day basis on what we need to do and what we need to do to supply them and keep them in operation. The Unified Command has actually set up a tactical operations center within the Unified Command to monitor the pod operations on a daily basis for what we are estimating to be up to the next 6 weeks. So we can maintain good situational awareness on what's going on at each location, and so the county can be poised to respond with any resource needs that may go beyond what the local pods can supply for themselves. So we are very much in a leaning forward posture from this point on, and the county has done everything that it can to be ready for this day, tomorrow, and for next week, and to be ready in every possible way to make sure that the pods are successful and that we have good throughput and that we're able to respond quickly and efficiently to any issues that may arise at each location. The success of these pods is our top priority, and we intend for them to succeed.
Director Rowley, thank you very much. Thank you, Linda, for the question. We appreciate that. It was a good opportunity to talk about how complex these operations are and have been from the very beginning. And a lot of drilling goes on, and we pulled up some video from 2018. It's on our YouTube page of a pod or a mass vaccination event that public health practices on a regular basis. And so a lot of that knowledge that has been gained is this is an extension of those drills that have been done over the years volunteers to be prepared for something. So if you're interested in that video, I would encourage you to go and see that on our YouTube page, and you can see what we've done in the past. And of course, this is much larger and quite a bit different with a lot of volunteers and a lot of healthcare partners as well. So thank you, Linda, again for the question. Ron, do we have somebody else?
Yes, Fields. Griselda Zatino, your line is unmuted.
Okay.
Griselda?
Hi, yes, thank you for taking my question. So I'm not sure if this was covered already. Could you provide me a status update on how many doses of the vaccine you currently have for the county, and then also explain what the arrival of the vaccine means for the community?
Okay, thank you very much, Griselda. So, yeah, final numbers after the 2 shipments that came in on Monday and Tuesday. I'll let Director Flanagan. We've got a pretty good estimate on that, and then also you had asked, what this really means for the entire community, and I can certainly tell you there was some excitement over at Banner. So, and Director Flanagan was there, so I'll let her talk a little bit about that.
So I hadn't given the numbers yet, but on Monday we received about 18,000 doses, and then yesterday we received an additional 25,000 doses. So that's what we have available here in Maricopa County. What this means for our community is, as I mentioned, it's just that small light at the end of the tunnel. But Monday felt like the first time there was a lot of hope in the room and excitement. It's something we've all been looking forward to, and I think I drove away from the pod location after we had taken it out of the shipping and put it in that ultra cold freezer with almost a sense of hope to go back to life as normal. We're not there yet, so I think that there's that little bit of anticipation. We want to get there. We want to get back to doing all of our normal things with our friends and family. But it's that moment of hope, but also pause to realize we need to stay vigilant. We know our healthcare partners are seeing some of the highest numbers we've seen since the beginning of the pandemic. Our daily case count has increased significantly. So now's the time to stay vigilant, but it gave us a little bit of hope in what we've been experiencing these past several weeks with our case count.
Thank you. Thank you for the question, Griselda. Ron, do we have somebody else?
Yes, Fields. Cameron Pullum has a follow-up. Cameron?
Yeah, I was curious about the National Guard deployment to pod sites. I know that there was a request that they would assist, and I know that depended on the governor extending their orders. Do we have an update on that? And then so shipments are going to you guys, and then you're dispersing those out. Is there a specific day that you expect to receive those shipments each week?
So I'll let Director Rowley answer the question about the National Guard here in a second, but I think it's fair to say we've been learning about these shipments sporadically. So there's no schedule that we're saying, okay, yeah, next Tuesday, Thursday we're going to get it or anything like that. So these first 2 shipments were expected, and but we didn't know when they would arrive, and then we got word very, very late, late in the afternoon, early evening on Sunday that the Monday one was going to come into place, and then late Monday we learned when the Tuesday. We had an approximate time of when it was going to be delivered. If you saw on Monday, it was delivered by UPS, so not dissimilar from receiving a Christmas gift, if you will, or a holiday gift. So, Director Rowley, would you answer some questions about the National Guard?
Yes, thank you. It's a fairly simple answer to that question. Yes, we are utilizing Arizona National Guard resources at our pod operations. Essentially, they are going to be filling in gaps that the healthcare providers are having difficulty filling. As you would imagine, in a lot of cases, it's people that have the ability to actually give the shot. And in other cases, it's just logistical support and other support operations at each pod. We've been meeting with the National Guard for the last couple of weeks. We actually met with them again yesterday evening, and they're going to be part of our Tactical Operations Center at our Unified Command, at least for the first several days of the process, just to be there to respond if there are any other resource or personnel issues that they can assist with. So the National Guard is always a very close partner with us in the emergency management world, so we are very pleased to have them as part of the operation.
Thank you, Director Rowley. And thanks for the questions, Cameron. Do we have somebody else, Ron?
Yes, Fields. Matt Roy is on the line. Matt, your mic is unmuted.
All right, good morning. I heard the word volunteer earlier. Is there any need on the county's level for volunteers from the community for this effort?
Yeah, good question, Matt. Yeah, we have a number of volunteers serving in different ways at the Public Health Department and in other ways. So Director Flanagan can expand on that.
Yeah, our volunteers are certainly an important part of our response and have been actually from the beginning. We've been utilizing volunteers in different roles and capacities. We are not in need of any additional volunteers at this time. We've had over 1,200 sign up for assistance in our pod sites. As we move through the different phases, if there is a need or a call to action for additional volunteers, we will certainly share that with the media and be asking the public to step up and help us. But the response so far has been wonderful. We're not in need of any additional volunteers at this time.
Matt, thank you for the question. Ron, do we have somebody else on the line?
Yes, Fields. Katie Davis-Young has a follow-up. Katie, you're unmuted.
Hi there. I have just a quick planning question for media. I haven't seen any details yet about media access to the pod sites tomorrow. Is the county planning on sending out any more details to media today, or should we reach out to Banner and Honor Health about that kind of thing?
I would expect something to come out a little bit later today about availability and where you can go. I know Honor Health has been communicating with the media directly about some media availability, and we would, if we will be working with Banner today to determine if they need us to send that out. But we fully expect media to have access at least to some parts of the pod, and we appreciate your patience with this. But as everyone's worrying about the logistics and how everything starts tomorrow, we'll make sure we get some availability out there for you guys, and as those things kick off around 8 a.m. tomorrow. Ron, do we have anybody else? I hope that answered your question.
That was the last question.
Okay. So yes, look forward to some more information either from the county or from our two healthcare partners, Honor Health and Banner, which are running the pods that are going to be opening tomorrow morning. And we will certainly get you more information as it becomes available. As we said, we have it's fairly small amount of vaccine at this point, but a lot is going to change over the next few days. So as we get more information, we'll be communicating with you guys. We always appreciate you joining us, and we appreciate those joining us via Facebook or YouTube as well. So thank you so much, and we'll be in touch soon.